We have been there last week. All right. In this picture, in this table, you can see different types of the jaw and the thorax. For example, intervertebral joint is symphysis type or secondary cartilaginous, but most of joints in the thorax are synovial, and you can see, for example, costal transverse joint. Okay, this is synovial plane joint. The synovial is the plane, and another thing is interchondral joint. For example, between the costal cartilages between 7th and the 8th ribs, for example, is a synovial plane joint, and some of them is cartilaginous, like a costochondral junction, costochondral junction, and you can see there are cartilages. And if you remember the types of the cartilaginous joint in human body, we've got two types of the cartilaginous joint: primary, secondary, as you see in this picture, is symphysis, and the primary, like a costochondral joint. Okay. In unusual places, you cannot imagine that the type of the joint. For example, the manubriosternal joint between manubrium and the body of the sternum. This is the secondary cartilaginous joint, or symphysis. Okay, here there is a fiber cartilage here. All right, one by one I will explain and talk about all right. Okay. You've got my voice and PowerPoint and cursor movement. You've got without any problem. Everything is okay. Somebody tell me. The voice, my voice. Okay. All right. Okay. One by one, I will explain for you. The manubriosternum is the symphysis, and the xiphisternal is the symphysis in the most of the books. But some books believe in xiphisternal joint is the primary cartilaginous. Okay, between xiiphoid process and the body of the sternum, this joint is the cartilaginous joint. In some book, secondary cartilaginous joint or symphysis, and some of them primary. At the costochondral junction is at this. It's actually we say costochondral junction or joint. This is primary cartilaginous joint. primary cartilaginous joint, hyaline cartilage and the bone. All right. And interchondral junction, interchondral junction, this place. You can see this is the okay, and 6, 8, 9, 10s, interchondral junction. The type of this joint is the synovial. And if you remember about the structure of the synovial joint, each synovial joint has these features, these details. We've got a articular cavity. We have articular cavity, this space. Fibrous capsule around this joint, and this joint is the fibrous capsule. And like this. And another thing is the synovial member inside the joint. All right. And because this, therefore, interchondral junction or joints are synovial, as you see in this picture. We've got an exception. Tens costal cartilage has a fibrous joint with 9 costal cartilage. This is the exception you must consider. But the other ones are synovial. And you can see here, for example, and there, interchondral junction between 7th and the 6th costal cartilages. And the next joint is the sternocostal joint or chondroesternal joint. This is the cartilage. Another term for cartilage is chondro. Chondro means cartilage. Cartilage is articulated with the lateral border of the sternum at this point. At this point, you can see this is the opened joint, and in this side you can see intact joint. All right. This is synovial joint. But the first one is the fibrous joint. And the first costal cartilage articulate with the costal notch of the monobilium sternum with the fibrous joint. This is the fibrous joint. But the other one are synovial, and you can find articular cavity, articular capsule, and the synovial membrane, like other synovial joint. But the second costal cartilage has because of having intra-articular ligament, this ligament, the articular cavity is divided into 2 compartments, superior and inferior compartment. The ligament at the costochondral as a chondroesternal joint, the fibrous capsule is like a rays. The fibrous bundles, this joint has a radiate and and this joint is radiate costal on anterior surface. You can find like this. All right, and another joint between the rib and the thoracic vertebrae is the costal vertebral and the costa. You can see head of typical rib articulates with the two vertebrae, two adjacent vertebrae. For example, if you consider this rib is the seventh, the head superior articular facet articulates with the body of the T6, and the inferior with T7, as you see in this picture. Attachment with intervertebral disc intraarticular ligament. This part of the head has a fiber joint with the vertebral disc, but the superior facet and inferior articular facet with synovial joint is articulated with the adjacent two bodies, two vertebrae bodies. All right. The fibrous capsule, we've got here fibrous capsule and the synovial membrane. Inside of the capsule fibers, like, and because of this we say this joint has a radiate ligament. As you see, the radiate ligament for two joints has a radiate ligament for between head of a rib, typical rib, and the two adjacent vertebrae has a terry bands, superior band, inferior band, and the middle band. Middle band is extended sometimes, attaches to the periphery of the intervertebral disc band. Anterior end of the typical rib and the thoracic vertebrae transverse, costal transverse joint. Costal transverse joint is synovial in type. Synovial in type. Costal transverse. This joint is between anterior surface of the transverse process, and the articular part of the costal tubercle. If you remember, a typical rib has a costal tubercle, and the costal tubercle consists of the two parts, articular part and the non-articular part. Articular part is covered by the hyaline cartilage and articulates with the relevant articular facet on transverse process of the relevant the thoracic vertebra. For example, if you consider this is the rib 7, okay, costal tubercle of rib 7 articulates with the transverse process of the T7, okay, the same number with the vertebra, okay, and Non-articular part of the costal tubercle is the place for the attachment of the ligaments. In this picture, we've got a transverse section at the joint of the costal transverse. Okay, this is the costal tubercle, articular part, and this is the transverse process of the relevant vertebra. And you can see costal tubercle is, sorry, is the place for attachment of this ligament. This is the lateral costal transverse ligament. Lateral costal transverse ligament bonds tip of transverse process to the non-articular part of the costal tubercle. And of course, this joint has additional two ligaments. One of them is the superior costal transverse ligament. Superior costal transverse ligament has two bands, as you see in this picture, two bands. Okay, superior costal transverse ligament. Superior costal transverse ligament bones crest of neck of a rib to the higher transverse process. I mean that, for example, if it's rib 7, crest of neck of this rib, okay, bonds to the transverse process of the T6. With superior costal transverse ligament. Another ligament is costal transverse ligament. Okay, costal transverse ligament. Costal transverse ligament bones posterior aspect of neck of a rib to the anterior surface of the transverse process. You can see easily in this picture the location of the costal transverse ligament. The gap between transverse process and the back of the neck of a rib is filled with this ligament, costal transverse ligament. Sometimes in a book you face to this term, inferior costal transverse ligament or posterior costal transverse ligament. These two terms refer to this ligament. Most of the time you hear and you face with this term, costal transverse ligament. All right, I abandoned this joint. All right, and then this picture is and you can take a look this picture as well. Superior costal transverse ligament here with its two bands. You can see superior costal transverse ligament, and this is the lateral costal transverse ligament, tip of transverse process, attaches to the or bones to the non-articular part of the costal tubercle, as you see in this picture. And another joint between two adjacent vertebrae or adjoining vertebrae is the intervertebral joint. At 30 places, two adjacent vertebrae are connected together. One is the joint between bodies of this vertebrae, this one. And by intervertebral disc, two bodies are connected together. The type of this joint is the symphysis, as I told you before. Okay, intervertebral disc, the fibrocartilage between between two bodies. And if you come back, if you see this picture, you can find out this is the intervertebral disc, a fibrocartilaginous disc. But superior surface of the disc body and inferior surface of the higher vertebra is covered by the hyaline cartilage. Hyaline cartilage. And the intervertebral disc is between them. And you can see this symphysis joint. Symphysis joint or secondary cartilaginous joint between bodies of the two adjacent vertebrae. But I would like to tell more about intervertebral disc because this is the very important structure between two bodies, two adjoining or adjacent bodies. Intervertebral disc is the fibrocartilaginous, but the disc consists of the two parts. Larger periphery part or peripheral part, we say annulus fibrosus, and the central, smaller part as the nucleus pulposus. Nucleus pulposus is actually gelatinous because of the high content of the hyaluronic acid and glycosaminogulicon molecules. And because of this, nucleus pulposus is hydrophilic, water friendly, and because of this absorb a lot of water, and during daily activity, I mean that at the end of the night, nucleus pulposus lost the water content, and because of this, the thickness of the intervertebral disc at night will be decreased, okay, because of losing water. All right, but the annulus fibrosus consists of the same center of the many lamina, you can see. Same center lamina. Of course, another thing is about the nucleus pulposus. Nucleus pulposus is not concentric in intervertebral disc, and the position of the nucleus pulposus tends to locate posteriorly. You can see it is pretty close to posterior part of the intervertebral disc. But if you compare the anterior distance between nucleus pulposus and the anterior part of the intervertebral disc, you can say compare. All right, the larger diameter between two parts. Because of this, herniation of the nucleus pulposus tends to move posteriorly than anteriorly movement. Okay, and most of the time, gelatinous nature of the nucleus pulposus tends to move or tends to herniate to the posterolaterally, in the posterolateral direction, and because of this, after herniation of the nucleus pulposus, the patient has a pain related with relevant spinal nerve. You can see if nucleus pulposus herniates to the posterolaterally, it compress the spinal nerve, and because of this, the patient has a pain, has a the motor symptom is motor symptom related to the this spinal nerve. Okay, and you can see here this is the vertebral canal, and this is the intervertebral disc. You can see the nucleus pulposus, and sometimes nucleus pulposus moves completely posteriorly, and because of this will compress the spinal cord because of this direction. All right, and another joint between two adjacent vertebrae is the zygophysial joint, this one. This joint is the synovial in type, plain synovial joint between two articular processes. For example, if you consider this vertebra, thoracic vertebra, this joint is between inferior articular process of this vertebra and the superior articular process of the lower vertebra. For example, this is if you consider this is the T6 or T7, inferior articular process of the T6 articulates with the superior articular process of the T7, as you see in this picture. Zygophysial joint, and they are actually they have actually a slight movement, but if you consider throughout the vertebral column, one by one, if you added all movements and you will see the large range of the motion for the vertebral column, flexion, extension, rotational movements. All right, and between two adjacent vertebrae, we've got some of important ligaments, and in this picture you can see the ligaments. From posterior to anterior, one by one, I will introduce the ligaments and tell more details about them. Okay, tip of spinous process between two adjacent vertebrae are connected together by the supraspinous ligament. This point is the supraspinous ligament. Supraspinous ligament attaches to the tip of spinous processes of the two adjacent vertebrae. Okay. And interspinous from the inferior border of the spinous process of the above vertebra attaches to the superior border of the inferior or lower vertebra. Interspinous ligament, the fibers. And this you can see capsule of the zygophysial joint, as I told you before in the last slide. All right. Another ligament is intertransverse ligament. Intertransverse ligament. And this one, intertransverse ligament, is between two transverse processes. Intertransverse ligament. All right. And ligamentum flavum. Ligamentum flavum. Ligamentum flavum, bones. two adjacent lamina, ligamentum flavum. In different pictures, these pictures you can see ligamentum flavum, lamina of the two adjacent vertebrae are connected together by ligamentum flavum. Ligamentum flavum has many elastic fibers, and because of this, appearance of this ligament is yellowish because of elastic fibers content, because of this, and therefore has a tensile property because of elastic fibers. And therefore, the gap between two lamina is filled by ligamentum flavum in the lumbar region and the cervical region. In this picture, I show you, all right, okay, between two cervical vertebrae, you've got a gap, okay? Lamina of the two cervical vertebrae is away from each other, and because of this, you've got a gap on each side. In the lumbar region, you see similar appearance, okay, the gap. And of course, this gap is useful for withdrawing CSF from the subarachnoid space at these places. I mean that in the cervical region and in the lumbar region, you can withdraw CSF, cerebrospinal fluid, for the laboratory analysis. But in the thoracic region, because of overlapping lamina, you have not any gap between two adjacent lamina. All right. But because of presence of the ligamentum flavum in the cervical region and the lumbar region, the gap is filled with the ligamentum flavum. But for withdrawing CSF, the tip of the needle penetrates ligamentum flavum first, and after that enters into the subarachnoid space. All right. And next ligament is the posterior longitudinal ligament. Posterior longitudinal ligament locates inside vertebral canal, as you see in this picture. This is the vertebral canal, and the anterior wall of vertebral canal, you can find posterior longitudinal ligament. Posterior longitudinal ligament, you can find out this ligament throughout the vertebral canal, but the superior extent of this ligament is limited at the level of the axis. I mean that the posterior longitudinal ligament superiorly attaches to the axis, and after that, in continuation with this ligament, you've got a tectorial membrane. Tectorial, and if you have the picture of tectorial, okay, tectorial ligament, but posterior longitudinal ligament, as you see in this picture, is ribbon-like, but is narrower than anterior longitudinal ligament. If you compare two ligaments, you can see easily. It's obvious. Anterior longitudinal ligament is the broader than posterior one. Posterior longitudinal ligament attaches to the superior and inferior lips of the body and the intervertebral disc, but in the middle of the body of the vertebrae, attachment is weak. because you've got this space for entering basivertebral vein. Because of presence of the basivertebral vein, attachment of the posterior longitudinal ligament at this place is lost. You can see there is no attachment for this structure, for traveling this structure. But the anterior longitudinal ligament throughout the vertebral column attaches to the body, to the intervertebral disc, and from the coccyx to the basilar part of the occipital, you can see anterior longitudinal ligament, and this is the good supporting structure for vertebral column in anterior. All right, and another things about the posterior longitudinal ligament. If you see posterior longitudinal ligament against intervertebral disc has a transverse band, as you see in this picture, transverse band, and the body you cannot find like this. All right. Another note about ligaments throughout the vertebral column is the ligamentum nuca. Ligamentum nuca. Ligamentum nuca is the fibroelastic plate, fibroelastic partition in midline. This is the vertical and is between external occipital protuberance and the spinous process of the C7 or prominence vertebral or vertebral prominence is well known. The spinous process of the C7 and external occipital protuberance. This ligament is formed by the joining by fusing supraspinal ligament and infraspinous ligament in the cervical region, in the cervical vertebrae. All ligaments fuse together, and we've got a ligamentum nuca. Ligamentum nuca has elastic fibers, and because of this, because of tensile property of the elastic fiber, you can keep your neck in a straight position with the less muscular action because of this ligament. Ligamentum nuca is a midline ligament, partition-like, has elastic fibers, and between paravertebral muscles at this neck, this ligament provides additional attachment for paravertebral muscles in this region. Okay, what's the time is left? All right, 18. Okay, and now I start to talk about the muscles of the thorax. As you see in this picture, some of the muscles in the thorax are intrinsic, some of them is extrinsic. Intrinsic and extrinsic terms indicate to whenever you consider a muscle, the origin and insertion of this muscle are located in same area. You use intrinsic. You use this term, intrinsic muscle. I mean that the origin and insertion. For example, you've got 20 intrinsic muscles in the hand. Okay, I mean that the origin and insertion of these 20 muscles are located in the hand, but you've got another muscles in the hand, but they are extrinsic, because the bulk of the muscle locates, and the tendons of this muscle, or tendons, for example, if you consider flexor superficialis, for example, the bulk of the muscle locates in the forearm region, but the tendons goes to the medial four fingers. Therefore, some of muscle in the thorax are intrinsic, some of them are extrinsic. And now I would like to consider the intrinsic muscle of the thorax, because in the anatomy of the neck, anatomy of the upper limb, you saw and you faced with this muscle. For example, in the pectoralis major, pectoralis minor, serratus anterior. You took a look at them before, okay? The last semester you saw. But the true muscles of the thoracic wall consist of this muscle. Intercostal muscles consist of the external, internal, and innermost intercostal muscles. Levator costarum muscles, this one, levator costarum, at the back of the thorax you can find them, and subcostal muscles. And another picture will show you subcostal muscle, this one, subcostal muscle, inside of the thorax, and the lower part of inside of the thorax, at the posterior wall of the thorax, you can find this muscle, subcostal. And in this picture you can see most intercostal muscle as well, transverse thoracis muscle. At the back of the anterior wall of the thorax you can find this muscle, and serratus posterior superior and serratus posterior inferior muscles. Okay, you can find at the outside of the thorax, on the posterior wall of the thorax, you can find these two muscles, serratus posterior superior and serratus posterior inferior. All right, and one by one, in the remaining time, I will talk about them. The first, intercostal muscles. Intercostal muscles, as I told you before, consist of the external, internal, and innermost intercostal. Innermost intercostal is limited at the middle to fourth part of intercostal space. Okay, I mean that if you divide into intercostal space into the four parts, anterior 1/4, middle 2/4, and the posterior 1/4, innermost intercostal, is limited at this region, middle 2/4. The first, external intercostal. You've got 11 pairs of this muscle in your body. The muscle feels the external intercostal muscle fills intercostal space from the tubercle of the two ribs. I mean that from the posterior, this muscle starts, posterior part of the intercostal space, this muscle starts. Where? At the level of the tubercle of the rib. And the direction of the muscular fibers is antro-inferiorly. At the costochondral junction, the muscular fibers of this muscle will be finish up. Okay, finish up. Finish at the costochondral junction, and in continuation of the muscular fiber, and because of this muscular from this point to the and we say cell intercostal membrane is replaced, and by this way this is filled by muscular fibers and fibrous tissue. All right. External intercostal arises from inferior border of attachment of this muscle is outside the muscle, and you can see as well intercostal muscles. In this intercostal space, you've got only internal intercostal muscles. All right. As you see in this picture, internal intercostal muscle fills intercostal space from lateral border of the direction of the muscular fibers, as you see in this picture, antero-inferiorly, and it continues at this point. Continues at the angle of a rib, and in continuation of the internal intercostal muscle from the angle of the rib up to lateral border of the vertebral column, you've got an internal intercostal membrane. Internal intercostal membrane. In this picture, we can see this is the external intercostal. Of the external intercostal is removed for taking a look at internal intercostal membrane, as you see. All right, because of location of the internal intercostal membrane and external intercostal membrane, location of them, we can use this term instead of intercostals, anterior, okay? All right. And I checked the time. Yes, we've got enough time for talking about the innermost intercostal. In this picture, you can see vertebral column. We are inside the vertebral column. This is the head of rib, neck of rib, and you can see at this point, you've got it. The muscular fibers with the same direction with the internal intercostal muscle. This is innermost intercostal muscle. Innermost intercostal muscle. You must distinguish between subcostal and internal intercostal muscle because the direction of the subcostal, innermost intercostal, and internal intercostal is the same. All right. Innermost intercostal. Location of this muscle is confined, is limited to the middle to fourths of the intercostal space. Okay, innermost intercostal. Coastal vessels and the posterior, the hidden innermost intercostal muscle. Okay, this is the origin of the nerve and the vessels. It will follow the track of the bundle. Bundle at the roof of the intercostal space is hidden of the innermost intercostal muscles. I mean that the bundle at this phase is between innermost intercostal muscles and the internal intercostal muscle, because the outside of this muscle you have internal intercostal muscle, as you say in this picture. All right, I'll show you another picture. This is the internal intercostal muscle. Okay, and this is the innermost intercostal muscle. As you see in this picture, the intercostal nerve is between two them. All right, all right, and the next muscles is the subcostal muscle. Subcostal is found. All right, it's picture better. Subcostal muscle is actually found in the lower part of thorax. Okay, on the internal aspect of the thorax, but in the lower part you can find subcostal muscles. Subcostal muscles arises from the internal surface of the rib and attaches to the next 2 or 3 ribs. Next 2 or 3 ribs. But the location of the muscles, the origin of the each subcostal muscles is the internal aspect of the angle of a rib. This place is the angle of the rib, and the direction of the muscular fibers similar to the internal intercostal muscle. Muscle. And as its name, subcostal depresses the ribs. All right. Okay. I think that the levator costarum. Okay. I'm just telling you about the levator costarum, and after that I finish this session. Levator costarum muscle consists of the two muscles. We have actually two levator. Differences between location of the insertion of each muscle. Levator costarum muscle arises from transverse process of the vertebrae and attaches to the external aspect of the external surface or external aspect of the angle of the next rib or next to ribs. Usually, insertion is the next rib, okay? Angle of next rib. For example, if you consider this is the T7, from transverse process of the T7, this muscle arises and inserted to the angle of rib 8, okay, next rib. But for levator costarum longa, attachment is to rib 8 and 9, okay. This is differences between levator costarum longa and brevia. And innervation of the this muscle is different from intercostal muscles and the subcostal muscles and other intrinsic muscles, because levator is innervated by dorsal or posterior ramus of the spinal nerve. But the intercostal muscles, transverse thoracic, subcostal muscle, serratus anterior, serratus superior, serratus posterior superior, serratus posterior inferior, are all together are intercostal nerve. Intercostal nerves. But the levator costarum innervated by dorsal spinal nerve. I will talk about the nature of the intercostal. And now I mentioned an intercostal nerve is the ventral ramus of a spinal nerve in the thoracic region. Okay? Intercostal nerve is the ventral ramus of the spinal nerve in the thorax. Okay, I think that is enough for today, and I will, in the next week, I will talk about remaining muscles like their diaphragm, and after that, I wrote the sympathetic chain, sympathetic trunk, and the relevant nerves, and of the next session, I think that I can talk about the mediastinum. All right. If you have any questions, I'm here. If you have any question, explain more for you for better understanding. All right. If you have a question, have you got? Or if not, I say goodbye to you all and have a beautiful day. All right. Okay. I think that there is no question. Don't be hesitant to ask question.